Cure is actually an awareness program. Our NGO, by the grace of God, we focus on women and children. And our major focus in this area of cancer is breast cancer, cervical cancer, and childhood cancer. So we know that cancer is there. Gone are the days when you think cancer belongs to the neighbor or somebody in some foreign land. It's here, it's right in our midst. You hear of children dying, people dying of cancer. We're actually doing Run for a Cure to create awareness that people don't have to die of cancer. Why? Because it's 100% curable if it's detected early. So we are campaigning to say, go out there, you know, go and do checkups. Don't just take anything for granted. Nobody's praying for evil, but come on. Wisdom too, it's important that we know. That's the whole idea. And also, of course, to raise funds, because we have children living with cancer. We, support them financially. We work with teaching hospitals and other organizations just to help those children, get their healing. And some of them actually survive it. It's quite a tedious process, right? But, I think what keeps us going is the passion for the work, So when you're done, people say, oh, well done, congratulations. You're like, thank God, because much as you've done so much, somehow you just feel, it just happens. You're happy doing what you're doing.
If you look at the world today and the increase in cases for cancer, and you think you can do something like an initiative to just support the cause, then I'm down. So basically running today as first of all, on the exercise part, it was some 8 kilometers. It's long, but it was fun. I got to work out, something I hadn't done in a long time, and it was just fun basically. And then I got to meet with great people, great minds, with a cause. There are people doing things on their own to support this, from cancer, children, breast cancer, all forms of cancer basically. And so it's been fun being here, met great people, and then supported the cause. So I'll definitely do this next year as well. All the 8 kilometers, I did everything. I ran in the rain, that didn't stop us, because the fight for cure is not something for now, it's something for the future. We want to grow up and think about what we've done to support the cause. It's all it is, really.
Well, we're here to support CS Done in the Run for Cure. So supporting child, cervical and breast cancer to raise more awareness here. You see, in Nigeria, no one is really aware of people, the challenges we face with cancer. So to raise more awareness and to donate to hospitals to provide cure for, or screening, if I may say, for cancer. I work with KPMG and we were the largest team, so I got a prize for motivating people to sign up.
We have good volunteers because, we're not so many. So NGOs actually depend on volunteers because we don't get money from any other source, So we have people who actually support us, help us, let people know organizations are aware. And we didn't start so big. We actually started in the school, the American International School. Through the school, then we came out, then other organizations got to know about it. They see what we're doing. Sometime last year, one of the runs we had a free mammogram, free mammography for anyone who was interested. So the outcome for us now is, look, cancer is real, right? You at least go for check, even if it's once a year or once in 2 years. Like cervical cancer, go for a pap smear. Breast cancer, to avoid that also, do a mammography. And beyond the mammogram thing, we actually we try to promote self-breast examination, where you on your own, you can actually know and tell if there's a lump or anything. That's what we're saying. It's real. You can prevent it. It doesn't have to happen with children. Like the run we had in June, we actually had a child, who had this growth, was cancerous. He was shown to everyone. I have pictures of children who we're actually working with. They're going to chemotherapy. Sometimes the problem is the wrong diagnosis. Oh, it's malaria. Oh, it's this. But it's something else. Go for more investigation. Know what is happening to the child. But the message is early detection is key. Once it's detected early and treated aggressively, 100% cancer is curable.
My name is Shola Alamutu. I'm an environmentalist. I'm a hospitality and ecotourism practitioner and also an advocate and promoter of natural health and wellness.
My name is Uche Obo. I'm a pharmacist and I advocate natural health.
The Green Health Project is a partnership between 3 different organizations. One is Kate Communications, which I belong to. Another one is Keys to Wellness, which my sister here, Uche, belongs to. And then there's Eden Streams. There's a group of environmentalists, pharmacists, doctors. So, and we're not necessarily all in the medical profession. We're just generally people who are in the profession and not, that are concerned about people living a healthier lifestyle, a greener lifestyle, and living longer, as long as God has actually ordained us to live.
We believe that healthful living should be having health in the fullness, not just healthy in every ramification, such as what we put on the skin, not just what we eat. So we're talking about the environment. We're also talking about what we put on the skin and what we eat, what we drink. So that is the picture of healthful in all areas. The 6 classes of food, they are supposed to be healthy, but because they have been refined in one way or the other, some have come out unhealthy. And so we'll talk about whites, we'll talk about fries, we'll talk about the fizzy drinks. So if you have the normal carbohydrate, fine, it's healthy. But if it's been changed to a white, in other words, it's been refined and the main nutrients have been removed, then it's unhealthy. So you have whites. And so that should be avoided. We have fries where people fry foods. Foods are not supposed to be fried. So it makes it unhealthy for the body. We have fizzy drinks where you have drinks that have been carbonated, they have phosphoric acid and have lots of sugar. They are not good. So those foods are not good, while the natural ones are okay.
One of the things we say is that, a lot of things that are in the air, you can't really do much about it. You may not be able to control the fumes from the generator until, something's done about it and all of that. But what it is you can control, basically, is what it is we are advocating that you should make an effort to control. The fruits, the avocado, for example, is fantastic for the skin. Lemon can be used as a cleanser. So the fruits that we already advocate that people should eat, because we want you to eat a lot more vegetables and a lot more fruits, can actually be applied onto your skin and do exactly the same thing without harming you, that all these other products actually do.
Yes, for a lot of these things, they can't do by themselves. For instance, she mentioned cleansers using lemon, using baking soda. Baking soda acts as an exfoliant. So instead of getting the one that is already contaminated with different chemicals, you just use baking soda in honey and lime. So you see that it's what is available, and then you use to exfoliate the face. Coconut oil is a very good moisturizer, coconut oil especially, and so you use that to moisturize the face.
Even table salt, you mentioned salt. Salt, for example, we advocate sea salt, organic sea salt, to be used instead. Table salt is so toxic, it's unbelievable. Honestly, it's like just taking poison. Seriously. It's very chemically based, because what has happened is that they've removed the nutrients. The one thing is to remove the nutrients in salt. I'm not saying salt is not good, or else I won't advocate for that. But then they now add chemicals which are harmful. Now the reason behind this white flour, white sugar, and white salt is just for appealing. It's so that it will look nice. So they make it white for you to look, so that it will appeal to us. Because when we show people brown salt, they're like, it doesn't look very nice. Or brown rice, or brown flour. It doesn't look nice, So, but what is the cost of changing something and making it look nice? And at the end of the day, somewhere down the line, I'm going to become ill or sick or die earlier than I should because of those products.
And sir, I must add here that, you see, these products we're talking about, the foods and all that, their effects are not immediate. Sometimes it takes as long as 20 years, 30 years for you to have them. And that's why you go to the hospitals at age 40, they expect that if you have hypertension, there's no problem. Oh, some people actually start at about age 40. How old are you? 40? Oh, yes, it's about that age. You have arthritis, they ask you, are you getting to 40 yet? So it takes a long time. So we have a cumulative effect here, where these things start showing up and then it appears like because you're growing old. So it's really not like that. If it's a situation of you eat, you fall and die, people will understand. But you can actually eat them for years and nothing happens. But the cumulative hazard is growing. And after some time, when the body is tired, it just breaks down. Because God has made our body in such a way that it detoxifies itself. So you take something like soda, which is very acidic. The body tries to find a way to neutralize it, okay? So you don't feel it. So it neutralizes it for you and you just move ahead. You take something poisonous, it just tries to neutralize it and you just keep going. But after some time, when all the compensatory mechanisms of the body become weak, then they start showing up. And then it's like, oh, she's getting to 40, oh, you're 45 and all that. So that's what really happens. It takes time for the effects to show. Okay, in the artificial products, you have the chemicals, like she's mentioned. The chemicals are not good. For instance, let's take the issue of white. Before carbohydrates, let's say wheat, becomes white, the vitamins, the oils have been removed from the outer coat, scraped off. Not only that, you know, it's blended and then is decolorized, okay? Deodorized
And bleached.
Yes, and bleached to give it that effect. So you have flour that has preservative, that has a bleaching agent, that has all kinds of things without nutrient. So that's what you're actually taking in. So those are the things that cause the effect. Those are the toxins we're talking about. I mean, they might not call it toxins, but they are really toxins because they're not doing the body any good. You can imagine having preservative, a chemical in your body. So what they do is they reduce the immune system, the functioning of the immune system, and from reducing the function of the immune system, all kinds of diseases can actually attack the person.
I'll say that one of the main things I want you to do is avoid. I say avoid. I will say eliminate, but I'll say avoid because it's very difficult. You've done something for the past 10, 20, 30, 40, 50 odd years. It's very difficult for you to stop. But you said something about what are the cons, what are the pros and cons. I'll take something, for example. When I used to take sodas ages ago, I realized that 1 week of not taking them, there's a weight loss. So I'm not doing any serious diet. Just 1 week of reduction of sodas and fizzy and carbonated drinks. I see the difference. And packaged, juices. I'm just talking about that. So what's the alternative? Increase your fruit intake. Increase your vegetable intake. There's an adage which is eat your fruits and juice your vegetables. As much as possible, everybody should have a juicer that they use to juice their vegetables. And they should buy more fruits. I mean, people just think, okay, I mean, a lot of people have heard this thing about, I need to eat more fruits. So somebody takes 1 fruit a day or 1 apple and thinks, oh, wow, I'm doing so much. But I had an apple, but it's really not enough because it's supposed to come as food and it's not filling. And that's why people then get hungry and then the next thing they're looking for some processed food or the other, something that's easy to grab. So I'll say if you want to have like a formula, eat at least 4 of these, any kind of fruits a day, and about 2 bowls of raw vegetable salads a day. And I am almost positive that there will be a difference. There's something we advocate called the 30-day challenge. If you try what I just said, for example, eliminate sodas, and then drink a lot more water. You're supposed to drink like an average of 6 to 8 glasses of water every day. So replace the sodas and beers and alcohol and all that with water. Add more fruits to your food, and if you eat more fruits, you are even likely to want to eat the junk foods less. I think that's just one thing I'll say. For 30 days, I am positive that there would be a difference.
So what were the sort of things that were happening to them that that resulted in their loss of their functions and the loss of limbs and so on? What were these things that you want to prevent from happening from now on?
Well, preventable causes. Causes like, say, a man having his lung volumes shrink for decades while the healthcare system does nothing about it.
What would have caused his lung capacity to shrink?
Well, maybe he needs to move for about 45 minutes to 1 hour every day vigorously and breathe and expand the capacity of the lungs. Maybe he needs to strengthen his chest muscles with breathing exercises so that they can continue to work, because there's a principle of use it or lose it, where the muscles would continue to get wasted because you don't use them. And believe me, in my offices every day, I see people who come in for their free check, and when I'm checking their lungs are like 70 years old when they're just 30.
What other things have been, there is somebody who's just simply not exercised enough, doesn't believe in exercise, maybe doesn't realize that exercise is prevention. What other causes have landed people in situations where...
Now, apart from being sedentary, many people today are serious drug addicts. Now, when we say drug addicts, we always think about cocaine, heroin. It's not true. A lot of people take drugs like they've got no side effects.
What sort of drugs are these people taking?
Well, believe me, some people just for that pain that is preventable, with some good posture, with some proper knowledge of the functions of the neck, of the back, of the various joints of the body, you could prevent that pain and you could reverse it, so reverse the processes, so you don't need that. But because nobody gives you that manual, just like you don't get the manual of your lungs to know that movement for 45 minutes to 1 hour could keep oxygen going into you for the rest of your life. In a similar manner, if you don't know that the various joints, the various muscles of your body would require certain movements, would require certain postures for them to be healthy, you use them the way you want to because nobody tells you about it, then what happens? Pain. And then when there's pain, nobody wants pain. And so what do we do, sir? We continue to take these painkillers. Well, what they do is they take away the pain. It's just a symptomatic relief.
They add something else.
They add something else. The side effects, the adverse effects, damage to various organs of the body, the liver, the kidneys, the various organs, and that is another lifestyle.
What about things like diabetes?
Well, that's another one.
What
about 80% of the body's demand for glucose from the blood is mediated by exercise. Now, when you take away that 80% from the body because of lack of exercise, what do you get? Too much sugar in the blood. And so,
point number one, exercise. And not just exercise, but enlightened exercise. So you're getting the exercise to reach all the parts of your body that
better to hunt in the fields for health on board than feed the doctor for a nauseous drought. The wise for cure on exercise depend. God did not make his work for man to mend. That was John Dryden at a time when people stopped to hunt for a sedentary lifestyle in England, telling them, let's appeal to our reasoning.
Now, so exercise is one. What are the other things you can do to prevent?
Good. Now, there are so many other things. One of them, too much of alcohol, harmful use of alcohol.
Ample use of
alcohol would be a risk factor for disease.
Okay.
The first thing for any individual is to find out their risk of dying. When you know that the various systems of your body have deteriorated so much that you could be dying any minute, then you are likely to be ready for change.
You talked about garlic, which is Allium sativa. That's the botanical name.
Okay.
A lot of people, you see, we consume garlic without understanding the health benefits. You can throw it in your soup and eat it. But the way we apply it as food is different from the way we apply it as a drug, as a medicine. And garlic itself, the Allium sativum, let me use the botanical name, or let me use the general name so that they will understand. Garlic is a very powerful antimicrobial agent.
Okay.
Which is very powerful. When we say antimicrobial, we mean it can inhibit the activity of microorganisms, in the case we're talking about bacteria, fungi, and all that.
Okay.
And the misconceptions we also have is we think by eating one lobe of garlic, all our problems will disappear. No, you have to comply.
Now, Dr. Balogun, let us say somebody came to you with cancer, and let me pick the two probably most common cancers in women, breast cancer, or in men, prostate. How would you go about it? What would you do?
At high risk, what we'll do, cancer itself is not such a big deal. Most people have been condemned to a life of misery because of that. But at high risk, we were privileged to have access to one very important remedy, one of which is what we call fibroma capsules. We call that fibroma capsules, which is an anti-tumor agent.
Okay.
Now, when we manage patients in a natural perspective, we don't just apply one single medication.
Okay.
We don't. It's an holistic approach itself. If you've been having a problem, for instance, for 10 years, in Ayurvedic holistic medicine, you must take medication for minimum of 10 months. But we have drugs within 6 weeks that will clear it. Okay. If you take the other drugs, orthodox ones, antimicrobial agents, you easily develop resistance. Because in our case here, we compound those drugs with about an average of 16 different herbs.
Okay. Let's talk about health, lifestyle tips to stay healthy. Okay. First of all, I mean, there's been a lot of attention given to obesity. Yes. Let's start by defining obesity. What is obesity?
Obesity is being overweight. Basically, you have overweight and then obese. A child who is overweight, a person who is overweight, it could be due to excessive fat, excessive muscle weight, or excessive water, or all three of them. Obesity is
excessive fat,
muscle
or water.
Or water. That's overweight. Being obese is fat, pure fat.
Okay.
And you're usually above the 85th centile.
Okay. What is the 85th?
Okay. You've got the body mass index.
Okay.
It's a formula where you have your weight and you have your height squared.
Okay. Okay.
And you follow it. Yeah, they have it all. There are different ranges.
Okay.
And when you're obese, you're in a certain range.
Okay. What does one do to prevent? Or let me start with the root of obesity. What causes obesity?
All right. Obesity, the cause is when your consumption of calories is greater than you're burning off these calories, and it's becoming an increasing problem in children. Nobody used to look at it before, particularly in the upper social class. In the States, about 30%.
Burgers and,
yes. Fast foods, KFC. So I shouldn't mention. I should mention them.
It's okay. Go
but
ahead.
yes, the fast food is a big fast food industry, which is big. It's a big marketing strategy.
It's become a big market in Nigeria as well.
Yes, exactly.
So that could be one of the contributory factors.
Other factors, obviously, is family history. It runs in families. Other ones are genetic and hormonal problems in a few cases. So it's always nice to get checked out just to make sure it's not
a hormonal
problem. Yes.
Okay. What can one do to prevent it?
As you said, well-balanced diet. Vegetables, fruits, being present in every meal. The whole thing is about 5 fruits a day. I don't know how feasible it is, but 5 fruits or vegetables a day is what is the other thing is children now, actually everybody, the society.
They eat vegetables.
Yes, they do. And like, if you can remember, eat your vegetables. It's always getting children to eat their vegetables. But you have to keep on insisting and then giving them fruits as well.
I saw one school where they turn the vegetables to a different color because they don't want green. And so by making them gray or red or something,
So
that attracted the children to them a bit more. So, okay, now somebody once told me about some of the problems people have because of the level of diesel or fumes that they're inhaling in Nigeria. That you know, our air is polluted. So it can cause asthma in some people. What can we do to help children who have these?
Asthma. Asthma worldwide is a big problem. I think it's 10 to 13% of children will come down with asthma. And clinical practice in my last 1 year, then the numbers are rising in Nigeria. And I think it's largely due to the pollution that's in the environment. Generators booming away. I don't know what you can do. Probably sort out the electricity.
Yeah, but also there is something else, I think. Maybe if parents located their generators
away
from the home, away it wouldn't. And another little thing is the air conditioner you use at home, for those who use air conditioners, could just be turned to recirculate the air that is inside instead of bringing air from the outside.
True.
Maybe that will help. Dr. Ajaibe, it's been great having you on the Heart of the Matter. We are more enlightened for having you, and we want to say a great big thank you to you for coming to the Heart of the Matter. Viewers, I hope you enjoyed this program. We'll be back again same time next week, and until then, stay mightily blessed.